So this afternoon, I am pleased to introduce today's speaker, Dr. Salah Uddin Khan. Dr. Khan has a PhD in public health from the University of Florida and is currently working as a postdoctoral fellow in the Department of Population Medicine here at the OBC. Dr. Khan's research is focused on studying infectious disease transmission in populations and assessing the efficacy of health interventions. With that, I'll turn it over to Dr. Khan to take you through his presentation entitled Using Computer Simulation to Help Inform Emergency Preparedness.
Thank you, Hannah, for the nice introduction, and thank you, OSRN, for inviting me for the talk. So here is the brief note on the topic I would like to highlight during this presentation. We'll start with the meaning of disease simulation model and why and when it can be useful. Then move on to a couple of examples of disease simulation research that was done here in Ontario. And finally, finish with some of our group's ongoing and upcoming research on disease simulation in swine population and how these findings could benefit the industry. Since most of the audience have a variety of background, I'll try to speak in generalized terms, so that is easygoing for most of the audience, and I'll try to avoid many of the technical terms and absolutely no equations. All right, so sometimes a solution to a problem is so complex that our conventional tools or approaches does not always lead you directly to a solution or to a right answer. Or simply said, we do not have the means to assess what-if scenarios. Here is an example. The real-life problems are often complex in nature, and with the simulation models, we tend to make simplified assumptions to get close to the truth as possible, and then refine the model until we're very close to the truth of the facts. The figure here shows a real-world problem and its solution and how it mimicked through a model with simplified assumptions. It's just an hypothetical example. Now, you might be wondering how to define a model. There are many definitions. Here is one that I find handy, describing the infectious disease model in a population, which is a useful, powerful, and accessible tool. It's a tool for evaluating questions about the spread of infectious disease within and between many population and our physical, social space and time. So why do we use model to explain the infectious disease that are currently not present in a population? For example, in Ontario, FMD is not present. So during its absence, we can model, given the population we have over here, how the disease would spread, how far would it reach, and how many farms would it affect, and how many animals do we need to cull or would die from a hypothetical outbreak. So gives us an understanding the extent of the outbreak and helps us prepare for the upcoming events if it occurs. And some of these diseases are very devastating for the population, like classical swine fever. So rather than waiting to see what happens when a disease occurs, it's a proactive approach to see what happens through simulation and identify what are the interventions, what are our currently known interventions that could prevent these diseases, and of course the what-if scenarios. So it's all about being proactive and understanding how our intervention would work. you've seen so far, I'm trying to avoid mathematical equations and too many technical terms during this talk. So this presentation could be easily understood by a broader audience. Here are the bare minimum data needs to build a model, disease simulation model in a population. This includes locations, the population structure. This could be the location where the farms are, their size, how many animals are there, and then how they're connected. For disease to spread from one farm or one animal to another, they need to have some degree of connection. They need to connect somehow. So it could be by the animal movements, it could be by movement of vehicles, it could be movement of people between the farms or sharing farm machinery or equipments, or simply it could be because of the proximity, because some of the disease transmit through air, or because of close proximity, or some of them might also transmit via vectors. So this also leads us to assess what pathogen are we trying to model, what type of disease are we trying to model, and how each of the disease has their own way of spreading. Their mode and rate of transmission is different. Some could be airborne, some would be direct contact, and some would stay viable in the environment very long time and could be transmitted via fomites. So all of these need to be taken into consideration for a model. So before we go further, I would like to talk about two examples of infectious disease simulation models done here in Ontario. Then walk through our ongoing and upcoming research. The first example is a population level disease simulation model. So it was done for the province of Ontario. First was the disease, the model. And to do that, because the population level data was not available, they randomly generated farm locations within the province. That was based on the 2011 census data. And they also came up with the direct and indirect contact rates of the contact and the percentage of and then simulated what proportion of farms that could be infected and the size of the epidemic. These simulation models, the researcher assessed the rate of direct and indirect contact and the indirect means of contact by the vehicles and personnel, and then have both of them put together in a model and say, let's say we have two different scenarios. In one scenario, the model will only assess what would be the rate of extent of the outbreak and the size of the epidemic due to direct contact. And the second one would say what would be the extent of the epidemic when we have both direct and indirect contact present for the disease spurs. Additionally, they made several assumptions on the rate and type of contacts between different production classes, the structure of population as well. And they ran this model for over 1,000 simulations and then presented the average of the outcomes. So here I'm going to spell out the key finding of the and their implications. They ran the model for a variety of scenarios. Here are the results comparing the epidemic size for direct contact, that is in the left, and the combination effect of both direct and indirect contact on the right. The direct contact scenario resulted a lower epidemic size. The median percentage of infected farm varied between 32% to 37%, while the combined, that is both direct and indirect contact, moved The percentage of infected farms range between 42 and 49. So when they have both direct and indirect contact, the size of the epidemic were larger. The combined scenario of direct and indirect contact also simulated larger epidemic size compared to the direct contact only. A larger proportion of indirect contact were attributed to the vehicle moving between farms. This means if adequate biosecurity measures were taken in place to limit PRRS transmission via indirect contact, there is a chance that the farmers could have minimized the size and the extent of the outbreak. The second disease modeling research I'm going to highlight is also on PRRS, but it's somewhat different in terms that here the population is not through the entire province, it's only a farm. And then they've broken the farm down to different units. One is the first isolation unit, then the breeding and castration unit, and the farrowing units. And then each of these, they model the disease for each of the animals within these units. So the animals were the agents for this simulation. This paper approaches with an what-if view. Here they say, what if PRRS is introduced in a farrow-to-wean farm consisting about 1,000 sows, which is typical of North America, and how would the outcome look like if the immune status of the herd varies? They wanted to compare the efficacy of two types of intervention. First one is the live attenuated vaccination and the live virus inoculation. That's the second one, to minimize the size of the outbreak in the herd. And they measured the outcome as infection, not disease. So when we say infection, it means the virus is present and replicating within the host. And for disease, in general, it says they will have some clinical outcome. So the figure shows the size of the epidemic after an introduction of a PRRS infected sow in a herd after 60 days of isolation and run over 100 simulation. It's a very busy slide, so I'll go over the figures one by one. The x-axis shows the day after virus introduction, and the y-axis shows the total number of infected cells. So on the top, three figures, that is A, B, and C, shows the baseline simulated, so there was no intervention there, and simulated the number of infected cells after introducing 1, 5, and 10 infected cells. So for A, simulation A, they introduced 1 infected cell in the farm, and for B, they introduced 5 infected cells in the farm, and for C, they introduced 10. And looked to see the size of the epidemic and how many days it took to develop the outbreak, the epidemic. So this is 100 simulations, so that's why it looks busy and it's somewhat different. So this, because this is a stochastic model, every time you run the model, it's somewhat different than previous. The figure on the modified live virus vaccination consisted vaccine efficacy. They consider what if the vaccine efficacy is about 95%. That is for G. And for H, it was 80%, and for I, it was 70%. The figure for live virus inoculation, first was the varying degree of infectiousness from the distribution. Second was the simulation after 56 days, and third figure with after 30 days of isolation. So when the breeding sows were brought in, they were in the guilt isolation room. So that they varied the duration of isolation in the breeding room. So in all cases, the intervention could not completely prevent piglets from being infected. So they also had concern over the negative impact of maintaining PARS positive population, as was done through live virus inoculation. So they concluded the management changes to reduce exposure to bacteria to eliminate losses, the McRebel approach to reduce the infection within the breeding herd to reduce mortality among infected nursery pigs. So they compared three different scenarios of three different immune status, and one was the baseline and the modified live virus vaccination, and the third one was the live virus inoculation, and then introduced infected cells and see the size of the epidemic and resulting the nursery pigs, what happens to them. In all cases, they saw that virus passed through the offsprings, and then they said, okay, all three of them were somewhat well, the live virus inoculation was somewhat effective, reducing the viruses within the breeding cells, but the following piglets, the piglets were still getting infected. So they recommended for a different approach. So now let's talk about our ongoing and upcoming research. So as you've seen previously, because of the privacy issues, getting the exact population structure, the right population structure for the pig farms in Ontario is difficult. Farmers do not want to reveal their location because of the privacy reasons. But for the simulation model, it is very important that we get the right population structure to run the simulation. And once we have the simulation, we wanted to look at what happens if some foreign animal diseases, for example, classical swine fever or FMD, gets introduced in Ontario, the commercial swine population. How far would it spread? And assess the known interventions. How efficient would that be? So let's start with the disease population model, how we came up with the synthetic swine population in Ontario. So why it is needed? Because it's a crucial first step to get the right population structure that we could introduce into the model. So the outcome doesn't go very far from the reality. And because of privacy issues, we cannot use, or we did not have access to individual level farm data, their locations, their farm size and production classes. So we came up with the approach to create a synthetic population that mimics the actual population or very close to the actual population within Ontario. First road bump we hit was the agricultural census. The latest one was from 2011 that had the complete data, although there is 2016 coming up. We still did not get the detailed information when we were running this model. So the 2011 census was our way to go. So when we looked at the census, it had incomplete data, as you can look from this table. The total number of pigs, that is the number of missing information. Almost half of them, in many cases, were missing. So with so much missing information, we are struggling to get a grasp on the population structure in Ontario. To add to that, the census doesn't give you the location of the farms. So we figured a way around. We said, okay, given that the information is not enough to find locations of the farms as well as the production classes, the different production classes and the sizes, the number of animals within each farms, we will try to look at the factors that influence the farm structure. What are the factors that support a farm within the province of Ontario? So there were a couple of them. It could be zoning and local regulations. The farms need to be away from the population structure, population centers, the urban places, and they should be within the agricultural zone. And availability of the land, it should not be on some of the government lands or recreational spots. The farms need to have access to transportation, and there could be geographical barriers like rivers. You cannot place a farm on a river. So we pulled up all those information. How? So what we did, we broke down Ontario into 1 square kilometer grids. So there were about 1 million grid cells like this one over here. And then on top of that, we put on different layers of attributes that could support or influence a farm structure, a big farm structure in Ontario. So this figure here, you see a river. On top of that, we added the road networks. And then once we have this information, we say, given this information, how far a cell is from a river or a road or a population center, and then calculated the distance. So once we have these numbers in place, we multiplied them and divided them by a factor of 100, and to get a combined suitability surface that score ranged between 0 and 1. Here you can see that, and then plotted this score over Ontario. So the Ontario looked like this. As you can see, the places that are darker are more likely or more suitable to support a pig farm structure in Ontario. So since we got the score, we said, okay, we had different attributes that could support, that could generate a model. How to validate the model? So to validate the model, we went to OMAFRA and talked to the premise registry section, and they helped us out with some anonymous data that gave us the actual location of the premise registry data, to say here are the actual location and here is your model, and now you can compare and see which model works better. So the model we preferred had a very high area under the curve. It's the accuracy matrix that consisted of proximity to road network, population center that is away from the population center and residential zones, away from the camp and recreational spots, away from the government and institutional land uses, and then away from the crown lands within agricultural equipment. So this combination worked better. So when this combination worked better, we said we need to define a cutoff within that scores. We had a score point 0 to 1. 0 means that is unlikely that this place would support a pig farm, and 1 means it's absolutely likely that it could support a pig farm. So we need to draw a line where we could say above this point we would populate and generate pig farms. So we run a bunch of statistics and Two of them were true skill statistics, which is sensitivity and specificity -1, as well as kappa, and then looked at where it had the highest specificity, and then defined a cutoff that for this model it was 0.82. So for anything over 0.82 and above, we took them and separated them. So for those surfaces, we overlaid the census data. The census data, the smallest unit was the CCS, that is Census Consolidated Subdivision. For each of the CCS, they will have the number of farms. Let's say for CCS A, that's an example, they had 100 farms. So we said, okay, within CCS A, we have these many surfaces that score 0.82 and above, and within this surface, we randomly generated 100 farms. So that was proportionate to the number what was given at the 2011 census. So once we have those random points generated for the farms, here you can see the red dots. These are random points based on the likelihood score and proportionate to the 2011 census. Then from the secondary data, we defined the class. How many of them would be far to finish? How many of them would be nursery piglets? So this type of production classes, as well as the number of animals. So our next step would be to, once we have this population structure, we would look into several foreign animal diseases that could affect the Ontario swine industry and see what are the known intervention and their efficacy. For example, it could be vaccination, it could be zoning and culling, and what are the combination of intervention that works better than others. So in summary, synthetic population that we generated that captured the key characteristics of the observed population and also preserved the privacy of the individual. So these points does not lead back to the individual producer, rather it gives us an estimate of how the swine farming population is structured over here in Ontario. For the aphid foreign animal disease modeling, we are trying to be proactive and assess the interventions, vaccination, zoning, culling. So many of you might know that OIE has came up with some changes to their regulation regarding zoning. So right now, the latest we have is from the June 2016. That says the zoning would be done through an agreement between the trading partners. So the sentence is somewhat loosely defined. So as well as your partner for Ontario here, we would say United States would be our biggest partner for trading for pigs and pig products. So we need to come up, whenever a foreign animal disease hits the country or the province, we need to come up with a rationale and say, hey, listen, we had an outbreak, we created a zone that is of 3, 4, 5 or 10 kilometers, and we did this amount of culling and this amount of surveillance, and the rest of the province is free of disease. So instead of calling out the entire country as infected, we can set zones and say, and with this simulation, we can come up with a rationale and say, within this zone, given our model, we see we can contain the outbreak in this given space, and we can still continue our trade. So in that way, we can minimize the loss of trade. Also important that these interventions could give us a heads up how much resources do we need whenever this CSF or FND hits the provinces, and what are the intervention that would work. So given that our advanced knowledge on these interventions, we would be better prepared to tackle this kind of devastating effects in the industry, on the industry. So with that, I would like to thank our team members, as Dr. Greer, she is leading our research group, as well as Terry Osloven and Jonomir Polzak, as well as people from the MAPRA, Janet team, and Alexander that helped us with the data as well as review our research work. So thank you, and happy Canada Day. And if you have any questions, please.
So if you have any questions, please feel free to type them in using the Adobe Connect chat function. And in the meantime, I'll ask Dr. Khan to speak to some of the questions that he has prepared, some of his frequently asked ones on his research.
So as we're talking, why population structure is important for infectious disease modeling. So as you have seen from this example that we provided, infectious disease needs host. The size of the host population within each unit here, for agriculture, let's say farm, the size of the farms, how many animals are within a farm, how they're connected, are they in one pen or are they in one enclosure, or are there a couple of farms that they're in very close proximity, or are there farms where the animals move regularly in between. So if one farm is infected, the chances are the farm that is connected to it would be infected after some time. So this population structure and their connection between them is important to mimic the infectious disease spread models. So the second question would be, can we develop models to see disease transmission within farm? So that was one of the questions I was asked before, so I kind of brought up the second example where Dr. Greer and Polzak, they showed that yes, you can also define a model to look at the disease transmission within a farm. Here, instead of having the farms as a unit, you have the animals as an unit, as an agent, and then run the model. Another question that pops up often is that whenever you run the model, the stochastic model, the outcomes are often a little different from the first one. Why is that? The disease is a biological process. And it's also because to capture this biological process, we define the model to be somewhat different. Let's, for example, the second paper we discussed, we showed here, the authors wanted to capture the uncertainty of the contacts, the rate of contacts, the amount of contacts an animal would have every day. It could be, they could have been contacted by 2 infected animals, or 1 infected animals, or 5 uninfected animals. So there is a bit of uncertainty. It's a biological process. To capture this biological process, we enter this uncertainty within our parameters. So every time we run a model, it's a bit different. So how we present these outcomes. So since the model is somewhat different, not so much, in most cases. So we run it for several times, 100 or 1,000 times, and then average out, say what's the average number of animals being infected after running this model. So we could say the average would have 10 infected animals, and it could vary from 5 to 12. So that is how we present our findings, and because it's a biological process, it will always vary somewhat.